My name's Emily Geisler. I live in Pocatello, Idaho. I'm 41 years old and I had COVID-19. So day one, headache, day two, headache, but full of energy. I did a bunch of projects around the house. It wasn't until day three that I kind of had a scratchy throat and I thought, uh-oh, I forgot to take my Zyrtec. Allergies, the smoke starting. And then day four, I woke up and something just didn't feel right. I lost my appetite. I wasn't nauseous yet, but I'd lost my appetite. Headache was still there, a little bit of ear pain, scratchy throat, and my glands were swollen. But I didn't have a fever or a cough, so I thought, okay, allergies maybe. I want to be able to tell my employees that I got tested and it's just allergies. And when I walked into the doctor's office, I said, okay, look, I don't have a fever, I don't have a cough, so just tell me it's allergies and let me go home. And they said, actually, people haven't been presenting, the positive cases haven't been presenting with a fever, so we can't rule out COVID. In fact, we're going to call you a presumed positive until a test says otherwise. So just go home. You must quarantine for 14 days and use Flonase and Aleve. So use Flonase to keep things moving, use Aleve for the headache. So the feeling that you get in your stomach when you go on a roller coaster that takes you upside down and you get off of the coaster and you're like, okay, I just need a minute, that's 24 hours a day. I was really sick with both of my kids. Remember, I said I'm 41. So it was a long, long time ago. I was 19, 18 at the time. So 20 plus years ago, I was incredibly sick with both pregnancies, and this is on par with that. I didn't lose my taste and smell though until day 9. I haven't gotten it back completely. I've gotten some taste back, but it's changed. So anything that has the slightest bit of bitter or sour or tangy is amplified by like 20. Smells are different if I can smell them. Things that, air fresheners that I loved the smell of before this now smell like floor cleaner. And I'm wondering if people have been judging the smell in my house this whole time. Maybe that's what it really smells like. I have no idea. Things that I miss the smell of coffee. I will say that is the biggest smell problem that I have, is missing the smell of coffee. Still drink it, but I can't smell it. And just knowing that you're sick with something that's all over the news makes it a little bit weird. Also, not being able to leave the house it's not fun. And I don't like going. I don't like leaving my house. But when you can't leave your house, that's a big problem. Although I've been cleared by my doctor's office and cleared by the health department, they're telling me that I'll have these lingering symptoms, the nausea I could have for months. We're just going to figure out a way to manage it. The palms of my hands are peeling. And when I say peeling, I mean like we're down to getting close to need to bandage my hands. I'm very fortunate and very grateful that it hasn't impacted my life. But I mean, I know that if a young couple had this with young kids at home and had to take care of their kids and didn't have a job that was accommodating, I don't even know what the financial or emotional impact would be. It'd be horrible. My friends, we love having weekends together. Our group of friends, our kids are old and we hang out and we have 4-day weekends and we played board games and yard games and we golfed together, and I miss that. I miss that connection. Texting, Snapchat, it's not the same as actually spending quality time with those that you love. based on what I've gone through, just be a good person. If you can do something to protect those around you, then do it. If that means going to the doctor when you're sick, go to the doctor. If that means wearing a mask, then wear a mask. If that means not going to public places, then don't go to public places. But if what you're doing could have a negative impact on someone, maybe don't do it.